Hello, everyone. My name is Alex Europidis, here on behalf of the marketing team at School Health. I'd like to thank you for joining us today and participating in our What is a School Nurse EHR and Why Every Nurse Needs One webinar. Joining us today is registered nurse Doris Thayer and strategic account representative at PSNI, Christine Drucker. Doris has decades of nursing experience in health facilities and school environments. Christine has over a decade of expertise in implementing and understanding how an EHR benefits schools across the country. We appreciate both of you for taking the time out of your busy schedules to be with us. We would also like to thank everyone who has joined today as well. Before I turn the time over to Doris and Christine, I would like to review a few quick things about today's webinar. We will not be taking audio questions, but you can submit your questions via the Questions Interface tab in GoToWebinar. You can submit your questions anytime during the presentation. Doris and Christine will present for about 45 minutes, after which we will take questions in the order that they were received. This webinar will be recorded and a link to it will be posted on the schoolhealth.com website, and we will email the link to you for future playback. Everyone who attends today's webinar will also be receiving a certificate of attendance for joining us. You should expect a link to the webinar in that email as well. If you are having technical difficulties with the audio or visual portion of today's webinar, please call GoToWebinar directly at 855-352-9003. The number once again is 855-352-9003. With that being said, let's turn the time over to Doris and Christine.
Thank you so much, Alec, for that introduction. It's so great to be here today with everyone. I hope everyone's doing well. So again, today's topic is what is a school nurse EHR and why every nurse needs one. And to meet our objectives today, we're going to review what is a SIS and what is a SIS health module. We will share some great examples of how to build a case and present to admin. We will explore a school-based EHR and the benefits and highlight some of the major differences between a SIS health module and a true EHR. That's when Doris will be demoing Snap Health Center, her chosen software. Then we're hoping to have time at the end for questions. So what is a SIS? It is a student information system. It's also known as a student management system or school administration system. Almost every district and school in the US uses some type of SIS to manage student data. There may be hundreds of SIS programs out there. And again, every district is using one. A SIS is usually designed as the one-size-fits-all software program for the district. That means almost all district staff use the same software, and that's to support their roles, whether it's teachers, principals, librarians, secretaries, even cafeteria staff. SIS capabilities range from student registration, grading, transcripts, storing test results and other assessment scores, creating student schedules, tracking attendance, and managing many other student-related data needs. So most SIS offer some type of health module. Oftentimes, the health module is bundled in at no additional cost, or the cost is very low. SIS vendors sell the health module as software that meets the needs of the school nurse and allows the nursing staff to use the same software program as everyone else. SIS vendors are great software developers, but they don't understand the role of the school nurse or your documentation requirements. How could they? SIS vendors are hyper-focused on the world of education, not the world of nursing. So again, there are countless SIS companies in the market, and every district in the company uses some type of SIS platform. There are very large companies like PowerSchool, Skyward, and Infinite Campus. And there are always new and emerging SIS vendors. And in my experience, because the market is so saturated, It's not uncommon for districts to actually switch their SIS programs. And again, most districts share the same philosophy that all staff should use the same software. The problem is that SIS developers do not understand the stringent documentation requirements or the workflow processes of a school nurse. So they design the software in a way that makes most logical sense to the SIS engineer. So let's talk about how you can present the case to adopt an EHR. In this segment, I'll share two stories. One is with a district that saved their EHR, and the other is a district that won a new EHR. In these scenarios, both nurses built a strong case and both were successful. The first story is based on a customer that had been using an EHR for 3 years. Their district was switching their SIS platform. The IT department asked the nurses to demo the software, and they wanted the nurses to try to use the same software as everyone else in the district. So the district's health director gave me a call and expressed her concern and said, "You know what this means?" And I did. I knew they would all want the nurses to use the same software. So I sent some information. It included high-level talking points and major differences between a SIS and a true EHR. Oops. So the health director assigned 3 nurses to review the information in preparation for the meeting. When the SIS company presented their health module, the nurses were prepared and they fired away with a multitude of questions, none of which the SIS company could answer. Because the nurses were ready with their talking points and studied the differences between an EHR and a SIS, they were able to explain why the SIS could not support their needs. And I'm happy to say the nurses were thrilled to keep their EHR. In this next case, a district nursing staff had been using the SIS health module for many years. The initial decision to use the SIS health module was due to costs and the philosophy that everyone in the district should use the same software. The nurses tried to make the SIS health module work. They even involved IT, who customized the software. Frustration grew and grew within the nursing department, and it was clear that the current processes were no longer sustainable. The SIS, no matter how much customized, it was not going to support their needs. So I met with the nurse director and demoed school nursing software. It was then that it was realized that a true EHR designed for school nurses would provide a solution. So she gathered her talking points and began building her case. The nurse director organized a meeting and invited every department that was affected in some way by the inefficiencies of the health services processes. This included IT, who had to customize the software, as well as run all of their reports when needed. It included risk management, who required an accident report for any injury that was potentially serious. Special education, who oversaw Medicaid billing and needed the nurses to capture billable time. Even the HR department, who felt the pain from the nurse turnover. The finance department was also present. Now, the nurse director's first goal was to help other departments understand the role of the school nurse. And she started the case by presenting data. How many visits were seen per day, per school, per year? How many meds were administered? How many treatments, screenings? She also presented the data in time. How much time were the nurses spending on things like vaccine management? And how much time were they spending documenting encounters? She shared that they diligently tried to make the SIS health module work, and the effort was in vain. IT was in the room so they could corroborate the story. So the nurse director presented a few scenarios, including vaccine noncompliance and communication with parents, issues with medication administration and inventory management, and time-consuming accident reports. The nurse director demonstrated each scenario using the SIS health module and her 20-pound 3-ring binder. Yes, she still had to use paper because the health module was not providing her what she needed. So after the demo, she made it was obvious during the demo that each scenario could take hours of time. So each item, vaccine management, hours of time, documenting and tracking vaccine compliance. After each scenario, she was able to show how the EHR could do the same process in minutes, if not seconds. So the demonstration brought to light that there was a serious issue with inefficient documentation, and it could no longer be sustained. And SNAP was the logical solution. It also brought to light the potential issues with managing controlled drugs, lack of insight into students at risk, and most importantly, it highlighted the overload of work for the health services staff. So in the end, all at the table agreed that current processes were extremely inefficient, and again, the EHR was the logical solution. The nurse director left that meeting with the support of every department present. Her next steps were to work with finance to show the cost associated with nurse turnover, as well as the cost to hire additional staff should they continue with the current inefficient processes. So I just shared 2 cases where nurses were prepared with solid talking points. They developed strong cases that were undisputable. The first case were nurses preserving their EHR. The second case were the nurses advocating for an EHR. School nurses know that most often other district staff truly have no clue what the role of the school nurse entails. The National Association of School Nurses, NASN, defines advocacy as deliberate processes, the deliberate process of influencing those who make decisions. In the case where the nurse director invited all the departments to meet, she was advocating and educating the staff. The NASN website provides a great resource titled Advocacy Tools. You will definitely find this helpful. So in this slide, it shares a list of talking points. These talking points are most effective when other stakeholders understand your profession and how a true EHR supports your role so that you can provide quality of care and keep the kids in class so they can learn. Now I'm going to hand over the presentation to Doris, who will demonstrate an EHR and the benefits, as well as highlight some of the major differences between a SIS health module and a true EHR.
Thank you, Christine. All right, let me get mine up to share. Hello, everybody. I'm very in tune to Christine's examples because I lived one of those. I am a former school nurse. That is a Massachusetts accent. But let me proceed with this presentation to help you voice the need of your EHR. A true EHR is so important because right there, specialty. We do have a specialty. It is a specialty in school nursing. A lot of our own peers don't even realize that. Oh, I'm an ER nurse. Oh, I'm an OR nurse. Oh, I'm a PD nurse. I'm a school nurse. It is a specialty. And you need to educate the educators, as Christine has said, and even the people you work with at the school. With that said, you need a specialized EHR, not a jack of all trades ones, and I'm rather passionate about that, and you'll see this, but basically, you want to know what that SIS can do for you versus what a real EHR can. A real EHR has to be FERPA HIPAA compliant. I used to tell my staff, remember, FERPA, the need and right to know equals audit trails. Find out if the SIS has an audit trail. Who else can see other areas in the SIS? Is the nursing supervisor the one who's going to set up the nurse rights as to where that nurse or health assistant can access? Can they access confidential? Who else can get in there? Find out. Don't be shy in asking your questions. As Christine said, the EHR really has a lot of elements. We have so many nooks and crannies in our day that people don't know unless they've walked that walk. That is for sure. So your EHR needs to be able to meet all of your needs, work the flow of your day. Do you have to do reports? Of course you do. Not only do you have district reports, you have state reports. Find out what reports can be done. Vaccine management, another thing we have to do. Screening mandates. When you're accessing a student's record and that student has an alert that should be brought to your attention, is there a way to flag it with a visual or audible based on how you want to flag it at the level of how you want it to present? Those are all the questions you need to find out. Who designed it? Who designed the SIS software component, SIS component for the health component? So who designed that? Was it nurses? Technical support. Ugh. Do you have to put in a ticket? Do you have to email them? And who's going to answer you? Is it somebody who even understands your nursing component question? All the key things you need to find out, because you have to have your specialized EHR. The examples, like Christine said, are going to be of SNAP Health Center, because when I was a nursing supervisor, that was the software I decided for my district. So basically, SNAP Health Center, when we say who designed your SIS component of the health component, well, in SNAP, from day one, it was a nurse right by the side of the engineer, the software engineer. In 31 years, they haven't missed a beat of that philosophy. It's so important that the software be what you need. We have a nursing informatics team that's part of the support that designs. I joke around and I'll say, well, if you can't find one of us nurses, go check that rubber room, because they're probably in a meeting with the engineers. It's quite an interesting dynamics, but it's a fun dynamic. Vaccine management. Well, we know what that's all about. Every state has its own requirements. Who sets up the requirements in your SIS? Are they complete? Do they understand that there is possibly, depending on your state requirements, a waiting period between vaccines? There's even a live vaccine rule. Does your program figure out if there's a 4-day grace period? How about a catch-up phase? How about based on age or grade? And the other thing would be, based on all that setup, how are those reports? Is it going to give me the results that I need for the state mandate reports and for me to notify the parents? Because we know the school nurse is the police, and being the one who manages and compliance of vaccines. So that you have to have the tools. How about a registry to your link to the state registry? which means it would automatically put the dates into your software based on the dates in the registry. So I will say that SNAP currently has 38 states that has a link with a state registry. Let me show you a report regarding immunizations. Bringing up SNAP, I'm going to go up to the reports. I need the students' names who are not compliant. I actually had an outbreak of pertussis. I had all these different choices to be able to run that report, so I was sure to keep the students out that met exemptions or conditionally enrolled. So check out the reports as of today. Okay, so I'm going to do it for all my grades. And before I hit search, I want to place them in a group, because whoever comes up non-compliant for any condition, a disease, I should say, I'm sorry, disease equals vaccines, I need to send a letter out to the parents of non-compliance. So when I scroll down, I have every student's name and the specific vaccine that they're not compliant for based on which disease that vaccine addresses. When I go to that last page, I have a total of 15 students. Well, now I want to proceed and process that form letter for immunizations. All of them not in compliant. And when I do, I would either print it or email it, whatever you end up having set up. And I'm going to save a copy. And when I click OK, it would be going out to the printer or the email at this point. But let me check, because I saved it. I can easily go right up to a health record. This one is up Julio. There's that notification I spoke of. He has an issue. I don't want to miss it. That's a visual audible. And I can go to the yellow triangle and go right down and see what the deal is and what the noise was about. I came in here to show you that saved letter. Right here is the immunize. Oh, it's not there. You know why? I have to go to the group. My first student in that group, it wasn't Julio. It was Carlton Banks. He too has bells and whistles, checking it out. There we go. Oh, good reason right there. But right here, today's date is the immunization letter that has been designed. Find out also, note to self, guys, find out, can I design my own templates for form letters? Can I tweak the library selections? So can I edit what I can use to create visits and so forth? So here's an example of a template of a letter for a non-compliant. This student, Carlton, has no vaccines, and I know that because they're the ones that he's not compliant for, nothing on file. But when I go to my next student in that group, this one here, this is going to be a sample to show you that you do have the ability to translate any letter into a language of choice. Okay, and of course the vaccines are in English, but the body of the letter gets the message across. And the next student I want to show you, so because it's different than the first one, is where this student, glass chandelier, well, she's not too bad. She only has one that's not compliant. And by the way, these are the ones we have on file. Used to love that whole process, believe me. Okay. Medication accountability. Oh yeah, another one. You're on the line for giving your meds accurately, safely. How about inventory of those class 3s? SNAP has the capability of automatically keeping track of your inventory. It even has the ability with one click to access Mosby online. It has the ability to bring up a picture of the student. And as a sub nurse before I became a full-time nurse, that would have been beautiful. Also, it has the ability to be able to look at notes that the nurse that created the order may have written regarding giving that medication to that student, such as, watch this one, he tends to pocket that med in the cheeks. It also gives you the ability, when you administer it, can you make a comment about that administration? Let's bring up Snap. So right here, I am going to go to my scheduled orders of the day. I'm going to go to my buddy Julio. He has Respidone. There's that alert. Let me point out what you've got going on here. This is the administration screen. This one click is Mosby. It's a great feature, and the most I like about it, to be honest with you, the pictures. Because there's, you know as well as I, depending on what the pharmacy has, that pill on the refill may look different than the previous refill. Going back to the administration screen, here are the notes that the nurse wrote when she created the order. Here is the dose. Here's a reminder, running low, you have 11 left. You told me to remind you, here's your reminder. So I'm going to call that parent and say, we're getting close, we need a refill. Okay, here is where I would sign it out. Again, it's a specific 4-digit PIN, and when I close this, you will then see there's my name that I've administered it. Let's take a peek of a blood glucose test order. Right up here, I even have the visible, there's the yellow triangle, but she's a special ed student, and this child is one that I bill for Medicaid. Once again, there are the notes. Mosby's not available because it's not a medication. Makes sense to me. Here, I'm going to go down and show you the order entry form. When I go to this order, I will show you, there are the notes I wrote, a nurse wrote when she created the order. Again, those notes refer to seeing them in the administration screen right here, notes. Then I also attached the original doctor's order because this is a complex thing. It's low carb correction, how much insulin, how many carbs, this and that and the other thing, what's the formula. So I attached that doctor's order right at my fingertips. I can review it if I wanted to with more details. Excellent feature for those substitute nurses, because if I was subbing, I would want to see that original order, even though the nurse did a great job putting it all in here right to the point. When I close this order, I'm in the administration screen. I'm going to put in what her blood glucose, her blood glucose level is. I'm going to put in here, she went back to class, and my comments, not the notes, my comments when I gave it, and I am going to say no TX needed for ND order, which jives with the notes, and yet again, sign it out. Done deal. But watch this. Because I used a special form when I created the order, the blood glucose test, I can quickly access Ariel's record. And when I go to her charts and I go to her blood glucose, there it is that I just did today. But more than that, flow chart speaks volumes. Parents used to ask me all the time, can you print that flow chart up, please? And I print it up, and it would even show details. So when I click on this 126, there's the date, the time, no treatment needed. What happened at 60? That 60 happened on 8/6 of 23 at 9:18 in the morning. She was 60, and the nurse provided the carbohydrate per order and observed for 15 minutes. All right there and ready to print if the parent wants that history. Close this out, and let's go to my next slide. Visit encounters. Good part of your day, you think? Well, here you have the ability, find out if you have the ability. Can I create a template for my common visits, or maybe even not so common visits that are real complex? The template would be a reminder as to what to do for that visit. It expedites templates, expedite documentation. That equals accurate reports, because if you document it, you're going to get the report. The ability to quickly access the parent's phone number, so when you need to dismiss that student, or maybe send an email, let's show you that. I'm going to close this, and I'm going in the visit log, and I'm going to bring up my buddy Peter Brady. Peter comes in and he tells me he hit his head. Okay, I'm going to use my template. This has been designed, again, always designed by the district, their standards of care to follow possibly their procedures and policies. Here I can click where on the forehead it happened, where I see it, swelling. So it brings in the template of your actions, assessments, and so forth, but everybody has a different answer. Right there, I am going to put in, it was a 2.5 centimeter diameter, brain freeze, no bleeding, and was redness. When you use a template, you can, if you didn't do, like I'm going to get rid of this alertness because this is the visit for him, I'm going to address the fact that he was oriented time 4 and alert. So going through, again, for time, I'm not going to do it all, but it's the same thing where I can put to the right. These are library items that can be customized. If something's in this list, find out. You're missing something in there. Can I make it happen for my district? I need it. Find out. Here I am going to call the parent. Well, I need that phone number. Click on Peter's record up at the top, the yellow folder. Go to his home. As Peter said, Mom is home. Close this. And when I go here, and I'm going to call, and Mom said, I'm going to say Mother, Mrs. Brady. All right, pretending she picked him up. So, yes, Mrs. Brady. And I handed her the head trauma info. What am I talking about? Well, we as a district added in here a information sheet to give to the parent and hand it to her, or I could have emailed it and so forth, what she needs to look for. Again, it didn't come with the program, but I added it. I wanted that for my staff. Over here, if it ends up being that it needed an accident report, it fit the criteria that I'm supposed to fill out an accident report, well, okay, right here, accident report. Once again, you can edit these form letters so they speak and they mirror what you need in your district. I'm not sending it to the printer, so I'm canceling all that out. Okay, so my next PowerPoint is the review of an EHR for a school nurse. Yes, you gotta be vocal, and can you tell I am? It is a specialty, and I think that is becoming more aware, but not for everybody. Okay, so be vocal. You need your own EHR. And the big thing with me is the liabilities. If you don't have the proper tool, how are you protecting your license for your liability of your license? If you're protecting your liability, guess who else you're protecting? The schools, the districts, because if you're not covered, they're certainly not covered. So basically, do your homework, find out, don't be afraid to ask questions, educate the educators, and be present for that SIS demo that they're doing. If they want you to use it, you want to see it. And I had my questions ready when I went through it, just like one of the scenarios I said that Christine presented. I had my questions ready, and I had 2 major red flags. He would show me something, or he would say he could do something, and I would say, show me. And he wasn't able to do it. Okay, but you said you can do it. Yeah, but I can't do it in this demo. oh, okay. And then I said, well, how about this or that? And I remember, like it was yesterday, he said, good idea. We can develop that for you. Those are two big red flags. There were things in the presentation I liked. I wrote my notes, what I liked. I wrote what he could not show me. I wrote what they promised that they could develop. Believe me, that's not developed overnight. That can be years. So write everything you liked, write things that it didn't fit your needs, ask to see reports. You need those state mandated reports and you need your district reports. So once you go through that, do your homework, filter out the EHR you want, then have a presentation. And who do you invite? Those same people that were telling you to use the SIS. I brought them into the room and I was able to present my case, and I ended up with my SNAP Health Center. So I can't impress upon you enough, be vocal and say your piece. Thank you, everybody. Christine, back to you.
Thank you so much, Doris. So interestingly enough, the few things that Doris demoed in the business case that I had been speaking about earlier, as I mentioned, immunization compliance was one of the items that was reviewed, and it would take the nurse hours upon hours trying to identify non-compliant students and communicate non-compliance. And as you can see, in a true EHR, it should not take that much time. It should take minutes. Same thing with the accident report. In that case study, the nurse, it took an hour to create that accident report. In SNAP, it's done in seconds. So there's so many different scenarios like that, and every district will be different, but there's always going to be one solid talking point that you can use. So we're going to start closing out. I do want to mention, so I've worked with Doris for about 15 years. And when I first met Doris, she made a statement to me that has stayed with me since day one. She described school nursing as there is no other healthcare professional that care for so many under one roof by themselves. And what is even more challenging is all of the activity needs to be documented. And that statement just has stayed with me, and it helped me understand the world of school nursing. So in closing, I'd like to recap that unlike the health module in Assist designed by programmers focused on the world of education, and EHR designed by nurses makes the software user-friendly and enables the nurse to chart efficiently. Different from Assist used for grading, teachers, and principals, the EHR is focused on the world of school nursing. Nurses need a comprehensive EHR that follows you so that you can spend less time documenting and more time providing health care. We realize that you're working in professional isolation and it has a host of challenges. A poor documentation system should not be one of those challenges. So you can start building a case by advocating. Again, use that resource in NASN to advocate for yourself. It's a really great resource. Help stakeholders understand your role, your profession. Start with 3 talking points. So the ones that are most impactful for you, whether it's vaccines, communication, FERPA compliance, whatever the case may be, start with 3 talking points. And I encourage that every school nurse, every lead nurse, every health services supervisor or director are always prepared with talking points, because you just never know when you will have the opportunity or the need to present your case. So that is the end of our presentation. I do hope it was helpful. And I'm going to go ahead and ask Mary Ellen to come on in and talk about our partnership.
Hi. Thanks, Christine and Doris. We appreciate your time and your explanation of everything that's been going on. with an SIS and with your with EHR systems. I'm just here to express a little bit about school health and our partnership with PSNI, who is also known as SNAP Health Center. For over 65 years, school health has been in the servicing and providing products and solutions for to help our customers, especially our school nurses. And therefore, we look to collaborate with those partners who can provide the best type of solutions for the school nurses and other customers. We want to help them and you, we want to help you, the school nurses, to be able to promote well-being for your students, healthy and well-being for your students. In order to do that, school health also has many different components to what we provide. We have local representation. That means that there are people out there you probably already know or already working with who can help provide you with the ability to get in contact with someone from an EHR like SNAP. They also can set up demos for you. You have the ability, working with school health, to leverage your national and state contracts. One of the great things about that is that we do have those, and those can really be one of those talking points to help you push home why you need that electronic health record and that specific one, and why it can be from school health. We also can help you utilize ESSER funding right now that is available to be able to use that to help subsidize your ability to get an EHR. And then finally, in addition to the local representation that we have, I am available. I work hand in hand with our reps, with our partners at PSNI, to provide you with information, content, demos, a variety of other things. And if you want to get more information, you can request a consultation, you can email me, you can go to our website, and you can request that demo and download a free case study that might help you also build on a case for having an electronic health record. So I wanted to say thank you all for your attendance today, and just see if there's any questions out there that need to be addressed. And maybe Doris and Christine could pop back on and help address some of those.
Happy
Yes,
to,
thank you, Mary Ellen. I'd also like to say thank you to Doris and Christine. That presentation was very thorough and it covered a lot of information. We appreciate both of you sharing your knowledge and experience with us. As Mary Ellen mentioned, and Mary Ellen is School Health's EHR specialist. She'll be joining us for our Q&A as well. And we did get some questions during the webinar. And the first question we will go to is from Laura, and she asks if are EHRs or SNAP standalone platforms, or could it integrate with our current system?
I'll take that one. So any EHR, a good true EHR, should be separate from the student information system. They really shouldn't be in the same platform, and most of that is due to FERPA HIPAA compliance. However, a good EHR should be able to interface with any student information system. So the nurses need to have daily updates in their EHR. So like Doris demoed, that she could get the parents' contact information, email addresses, all that information should be updated every evening. And there's other fields that should be brought over as well. So again, a true EHR should be separate from the student information system, and it should interface with the student information system, so the nurse has updated contact information.
Thank you. We have another question from Anna asking, is it easy to use SNAP to communicate with parents about their children's health?
Want me to take that one, Dot?
Sure.
And you can jump in, please do.
All right.
So yes, there's a couple of different ways you can communicate with parents. As Doris was showing you, there's old-fashioned print and throw it in the backpack and hope it gets home. There is emailing capabilities, and when emails are sent out, it's FERPA HIPAA compliant because it is encrypted and password protected. And then we also have a health portal where the nurse can send a message to the portal and the parent accesses, just like you would your doctor's portal. So most often they're using electronic communication, but we always have printing available too, because not every parent has an email address or has even a smartphone for the portal.
Thank you. We are also getting multiple questions relating to the cost of SNAP or like a quote estimate for an EHR. Could one of you please go into detail about that?
I'll take that one. So as the partnership with SNAP or PSNI, School Health can help provide you with those costs for budgeting. We can provide you with a quote. We can do that based on any national or state contracts. We would be able to provide that to you. And it's dependent on users, students. So there's a lot of little variables in there. And we would work through that with you and with our partners to come up with that pricing.
Thank you. Molly asks, could you please tell me what type of support is available for EHRs or this, and specifically this one, SNAP?
You're looking at one of many support people here. Nursing informatics will be support as well. We have online where you could chat online if you choose to. Send us an email. The online chat is more instantaneous. It's real time, where emails are emails. Or you give us a call and you talk to a warm body. And if that person cannot help you out, when none of us are shy, including me, and if I need to escalate a question, I'll find out if one of the more technical people are available, because I'm more nursing, and vice versa. If one of the tech people cannot answer a question, or they feel as though this really should be answered by one of the nurses, because we're all full-time nurses here, they will escalate it and see if someone's available, and we pick it up. So support is another question you really want to make sure to find out. Like I had said, is it a ticket? Only emailing? How long you wait to get a response? Support is key, because you haven't got time to wait for an answer if it's something you really needs to be addressed. So that's a big question when you're investigating your EHR as well as the health component in the SIS. And who answers those support questions? That's the other biggie. I've heard people say they didn't even know what I was talking about. Okay, so.
Thank you, Doris. Appreciate that. Next question comes from Pano, and he asks, how long does it take to implement something like SNAP? Are there resources? What's a typical EHR? How does it get implemented into a school or a district?
I can take that one. So implementing SNAP is very straightforward. We've been doing this for 30 years, so we have a complete onboarding process, which includes supporting IT for creating the interface between SNAP and the student information system. It includes a solid training program. I don't know if it was mentioned, but our nurses not only are former school nurses, but they also use SNAP in their districts before coming on board. So they have the expertise in usage, and they also have the expertise in training. So the two key things is the onboarding with your student information system and also the training. And really what it boils down to is the district making sure that they set time in their day to set up the interface with SIS, and the nurses set the schedule for their training. So it's a very straightforward setup, and it can be done in as little as a week if there's really solid communication and people have their schedule set.
Thank you. We have our next question from Janet, and she asks, can physicals be directly downloaded to the EHR?
Do you want me to take that?
Answer that?
Sure.
Got it. It can be scanned and attached. So like any scan at this point, it would be scanned and you would say that it was present and see scanned and attached. But if you need specific information from that physical, you would put it in the form so that it can be captured in the report.
And let me add to that real quick. With the portal, the parent can actually take a picture and then upload it to the portal, and then it will go into the child's screening section.
Yep.
Thank you both. Our next question, and Christine, I believe you did touch on this. Our next question comes from Katie asking how the training for an EHR or something like SNAP works.
Well, we do right now, or since COVID, we pivoted to virtual. So almost all of our training is done virtual. It saves the district costs for travel, trainer travel. But again, we've been doing this for 30 years, and now we've been virtual for 3 years. Has it been 3 years, Doris? Yeah, so they actually have a really great approach where it's not just a watch and learn, but it's the trainer goes through SNAP. Say, for example, Doris demonstrates how to create a visit. And then she says, okay, now we're going to do this together. It's practice time. Johnny comes in, he says he feels low. Now let's all document a diabetic encounter. So it's hands-on as well as it's not just watch and learn. And it's been very successful. And we also train the nurse admins. So these are the SNAP administrators, because the nurses have full control over the software. They can customize their visit templates, their form letters, just about everything in the software. So they can tweak it to meet their district specific needs, and they're trained on that.
And I might add, when we do train, it's in a training database, so you don't have to worry about having to use, we don't want to train in your real database. So when you're training with us and you're doing that hands-on, don't worry about it. You can't break it, you can't hurt it, you can't do some weird documentation because they're not real students. So you have the liberty to practice and go and try things and go checking it out.
Thank you both of you again. We have another question, and we are running out of time here, so we probably will only get to a couple, 2 or 3 more questions, I'm guessing. Our next question, though, comes from Susan asking if SNAP communicates with state immunization registries. And I believe one of you touched on that earlier in the presentation as well.
Yeah, we have currently 38 states registries that communicate, so that means it downloads into SNAP. Christine, are there any of them going both ways?
There's a couple of states that require historical data to be sent back. I believe Kansas and Idaho are 2 of the states. But also with the state registries, the nurses call it a game changer. That's what they refer to it all the time, because it's saved them so much time.
Yeah, in the training, we teach you how to enter immunizations in quickly, because that was something that I had to do all the time. It was like, and there's a shortcut and quick way of entering immunizations, and we teach you that as well. Because sometimes, even though you have the registry, we're all human. The doctor's office hasn't even submitted them yet, especially if they move from one state to another. So they're waiting, but yet I get the hand physical, the hard copy, and I'm putting them in my software right off the bat because I could find out if indeed they're compliant. So you can do both. Even though you have the registry and you want to put some in there because you have that physical with the IMS in it, you're able to do it. And right away, I used to put my immunizations in, click to view compliance, then see if they were compliant, If they weren't, I'd make sure I didn't do human error on the date, but if they weren't, I would print that letter right off the bat and get that letter out.
Thank you.
Mhm.
I believe we have time for one more question before we end. And the next question comes from Kenesha asking, could a list of speaking points be provided to help with advocate to school leaders?
Yeah, I can share that with Mary Ellen and give those solid talking points. And one of the things, being nurse centric, will help advocate and will help give you all the tools that you need. And again, not just our talking points, but NASN has that great piece right on their website, and it's just talking about it, just in general, advocating as a nurse, because again, the other district staff don't understand what you do, and just helping them understand is a huge step, the huge and biggest step.
Yeah, I was going to say Christine can provide those to me, and we will provide them to your local reps to be able to share with you. So I know that Alex will tell you about a survey at the end. If there's something that you would like, just jot that in there and we'll get back to you with that information.
I was just going to say, don't remember FERPA. Don't forget FERPA, because you really do need to be compliant, So that's one of the talking points you want to make sure that you cover and ask in depth about the audit trails, because that's where it's at. And naturally, if you're HIPAA, that's another piece, but most schools are FERPA. Unless you're doing Medicaid billing, you flip into HIPAA, but that's so important. And when it's an all-in-one, be careful. They'll say, oh, well, technology can see everything. Okay, so does technology have the need and right to know what's going on with a student's record and see it all? Don't think they need to see conditions and medications, what a child is on to manage the program. So be careful. Talking from personal experience, be careful.
Thank you, Doris. Thank you, Christine. Thank you, Mary Ellen. And Mary Ellen, that was also a great segue, because that is all the time we have for today. Thank you, everyone, for attending today's webinar. We hope you found all this information very useful. Thank you again to Doris and Christine and PSNI for sharing all this important information with us. To all of our attendees, after you exit the webinar, you'll see a survey window. We would ask each of you to please take a moment for this brief survey and help us improve what we've done here today. And that will end today's broadcast. Thank you, everyone, for joining us.